shall we start the session? Assalamu alaikum. My name is Dr. Ahmed Usman, and I am currently I'm a final year student at National Medical University, Multan. Today we are gathered here to have this session on opportunities for international medical graduates in Australian health system. Our presenter is Dr. Faiz, who is also an historian from N47. He is currently practicing medicine as a general practitioner in Sydney, Australia. Now, without any further delay, I would like to hand over the mic to Dr. Faiz. I just have one request for all the attendees that please write your questions on a paper and ask the questions that by the end of the session we have a dedicated 10-15 minute time period for question answers. So write it on the paper and then ask by the end of the session. Sir, is my voice audible? Are you up?
Yes, I can hear you.
Okay, so let's start the session.
Okay, can you guys see the screen?
Yes, sir, we can.
Alrighty. Okay, Assalamu alaikum and hi and hello everyone. My name is Dr. Faiz Salim Qureshi. I am a fellow general practitioner working in Australia at the moment since 2011. I'm also currently working as an MRCGP supervisor. So we do train the GP registrars as well under our supervision. I'm also the registered GP provider for the focused psychological strategies, like I can do the counseling session as well. So I did my MBBS from National Medical College in 2003 and completed my FRA-CGP in Australia in 2022. So currently I've recently done diploma in diabetes as well last year, and I'm about to finish my MSc in diabetes in September. So I've got certification from both Australian Medical Council as well as ECFMG Australia. So I will first start the lecture, and then I will just briefly mention my story as well coming into the Australia so that you can get more concept about the AMC, Australian Medical Council, AMC pathways. So let me just organize my slide a little bit. Okay, this is better. All right, so look, current situation in Australia is that in 2023-24, there has been registration of around 9,490 doctors, including 5,717 doctors from the other countries, which we call in Australia as international medical graduates. It's not written in the slide, but please note that till 2030, Australia, according to one of the literature and the report, needs around 11,000 doctors. And I've heard from other resources that Australia needs around 15,000 doctors. And most of these doctors needed are actually in the line of general practice. There is still significant shortage of doctors, especially in the rural and regional areas. And there are opportunities for both junior doctors as well as the specialists. Benefits of living in Australia are that as a junior doctor, you can start at a good salary from between $80,000 to $140,000 per year. This is a good salary when like this $80,000 is probably for the doctor who starts as level 1 or level 2 intern or resident medical officer. When I started in Australia, I was enrolled as a level 4 resident medical officer. And at that time, I was enrolled in Western Australia and my salary was $85,000 per year. And when I became a registrar, my salary went up more than $100,000 per year. But at that time, salaries were less. Now the salaries are more than what they were in 2011, 2012. Fellow general practitioners, when they start working, their salary usually starts around $150,000 per year. But later on, they can go up to $450,000 to $500,000 per year. However, the rural general practitioners, the rural fellow general practitioners, they get around $350,000 to $700,000 per year. And if they have got their own practices, they can actually earn more than $1 million per year. In the subspecialties, varying from different subspecialties, the range of earning can be between, actually, I've written 200 to 1,000K, but it can actually vary between 120 to 100, like around 1,500 $15,000 per year. I think I was supposed to write 1,000K. Yeah, that's correct. So it can be between around 150 to $1.5 million per year. In Australia, when you work even as a junior doctor, if you work overtime, for example, due to some unwell or critical patient, you get late, you were supposed to leave at 5 p.m., but you leave around 6 p.m., you will get paid for that extra 1 hour. So I'm not aware whether this is the same rule in America or in England or not. Currently, when I did observership in America in 2006, there was no such rule in America. In America, the doctors used to go early in the morning around 7 a.m., depending on how junior they are. And then they used to leave around the same time as that was their routine almost every day. It was a very a hardworking culture. I'm not trying to say against that. It's a good, it is good as well that the doctors were working so hard, because the more you will put the effort in your training, the more actually you will be learning later in the time when you will be working as specialists or subspecialists. It's a relaxed work culture in Australia, but obviously this comes with the responsibility. It doesn't mean that the work culture is relaxed and there is no responsibility. You have to be responsible. It's a peaceful country. It is multicultural. Whether you are Muslim, whether you're Christian, whether you're Hindu, whether you're Sikh, or you belong to any religion, any culture, you can work easily in Australia. It's very multicultural, and the people are very tolerant and to different cultures, and they have respect for the different cultures. And this is one of the picture from Sydney locality. From the locality of the Sydney, you can see that it looks like maybe you are in some Arab country, or maybe in Bangladesh, or maybe in Pakistan. And so it's a very multicultural country. People and the professionals who come to Australia, they actually fall in love with this country. Okay, so one thing I've mentioned about the salaries. Other thing is the resident tax rates. I don't want to go into much details of this, but at the salary of $18,200 per year, less than this salary, actually there is no tax. So we doctors don't come into this category. Even the second category as well, between $18,200 to $45,000, there is 16 cents for each $1 you get money, you get earning. But again, this is not related to the doctor. But yes, this $45,000 to $135,000, then there is a significant taxation that starts. I would not like you to go into this, because many of the hospitals, if you get enrolled into the hospital, many of the salaries are actually, they come into your bank account after deduction of the tax. But if you work as a general practitioner, you are responsible for paying your tax, and you have to hire some accountant. So not to get into trouble with the government, your tax should be properly paid. So savings as the junior doctors, that depends. I would also not like to go into this detail. I would also not like you to think too much of this. Look at your circumstances. You can get all these details on the internet. It depends. If you will live the simple life, you might be able to do some savings. But if you will live a very extravagant life, you will start looking into buying Lexus or BMW cars, working as a junior doctors, obviously you will then have difficulties in making your savings. So you have to make that decision based on yourself. But if you have got too many responsibilities and you need to start earning from the beginning, and you need to do some savings from the beginning, make sure that you're making the right decision, because keep in mind that the rents in Australia are very high, especially like Sydney is one of the expensive cities of the world. However, it's at the moment it's not possible to get job in Sydney, but even if you go to the remote areas, the living can be expensive, and Australia is one of the expensive country, but the salaries are good. I think you can do some savings if you live a simple life. So, but that depends from person to person. Now, let's come to the licensing exams preparation. Yes, I agree. You should get the information about the living cost and exams according to your circumstances. For example, if you have responsibilities, if you can't afford this pathway, don't just put your money into the gamble. Any pathway, whether it is United States, whether it is Australia, or you're trying to go to New Zealand, Germany, or any country, keep in mind it's a gamble. There is no 100% surety whether you'll get the job or not. I would try to give the positive vibes, but I still want to give the reality check as well, that look, we get on the internet the successful stories. We don't know whether the people who are failure, who could not get the jobs, we don't get the stories of those people, because they silently either go back to their countries or they go back to some other countries. During this time, when you are trying to get the information and you are trying to prepare for the exam, I would like to advise, do not waste the time. Keep making your CV and cover letters. What is the purpose of saying this? I don't want you to sit in the library forever and keep doing the preparation of the exam. I want you guys actually to make the to do some job during that time, and at the same time do the proper preparation of the exam as well. All right. So other thing is, I've written learn better lifestyle. By mentioning that, I want to say very straightforward, bang on statement. Do not get into any trouble in terms of the law. You should not be having any criminal offense on your record, because then it becomes difficult to get the visa. Means you should have a habit of doing some exercise, doing some jogging, and having some good lifestyle. Means that you should be having a good health as well. And if you are like doing jogging every day, if you are doing some gym every day, Australian system like those doctors who look smart. But by saying that, I also want to clarify to you, if for some cultural basis or religious basis you have a beard, like for example you are Sikh or you're Muslim, you have a beard, or you wear some cap, or you wear some pagdi on your head, you should not be worried, because Australia is very well adopted to this culture, and they actually respect the religious and the cultural beliefs. You should be law abiding. You should be punctual. If your duty is from 8 a.m. to 5 p.m., you should be in the hospital at least at 7:50 a.m. If you leave the work at 5:10 p.m., that's not a problem. But if you leave the work at 4:55 p.m., that is a problem in Australian culture. So you should be very punctual. You should be caring. If you have opened the door and somebody from the back is coming into the door, please leave the door. Please hold the door for the timing until that person comes inside. If there is some old person in front of you, give space to that person. Be caring, be apologetic, be humble. And this is what they like about the doctors working in Australia. Before actually going into the exam of Australian Medical Council exams, like your first exam will be the AMC MCQ exam, you need to make your account on the AMC portfolio. You need to do the verification of your qualification through the primary source verification. That is called electronic portfolio of international credentials. It is done, it is the EPIC verification, which is done on, I think, the ECFMG website. But once you have done this verification, you have to give the exam within 12 months. So when I gave my AMC Part 1 exam, AMC MCQ exam, I had done this verification just 3 months before the exam, because there is a fee for this process as well. Okay, after this, let's come to the AMC MCQ exam. This exam consists of 150 questions. 120 questions are scored, and 30 questions are the pilot questions, which are not scored. But when you are giving the exam, you need to perform in every question, because this is not visible to you whether the question is a pilot question or whether the question is the genuine question, which will be scored. This exam has adaptive nature. Like once you start doing well, actually you start getting the difficult questions. So if you are not getting the difficult questions, it means you are not performing well. So, but if you start getting the difficult questions, it means that you are performing really well. But another point to note is, when you have a very good preparation, actually none of the questions should be difficult for you. And the duration of this exam is 3.5 hours. You need at least 1.4 minutes per question. So when we were preparing for the exam, during the MCQ practice, we used to actually try to do the question in 1 minute. The course of this exam is 30% of part of this exam constitutes general medicine, 20% surgical questions, 12.5% are obs-gynae questions, 12.5% from peds, 12.5% from psychiatry, and 12.5% from population and health and ethics. Population and health ethics. I know some of the Asian countries, medical students, they might be little weak if the study style has improved. Now in our times, we used to be very weak in this subject, but I can tell you that now that this is actually a very easy subject. You actually put some effort into this, and you can easily perform these questions. But I think with time, I have learned that even the education system in Pakistan, India, Sri Lanka, and Bangladesh has really improved as well. The cost of this exam is approximately $2,920, according to the information that I got last time. The pass rate of this exam is between 46 to 51%. But I can reassure you, if you study well, if you do it with the proper methods, with the proper practice of the MCQ questions, you can actually easily pass this exam, and this is a very, very doable exam. The exam preparation can vary from 4 to 12 months, depending from person to person. On average, it's going to be between 6 to 12 months. And I also want to let you know that this exam is actually a very similar exam like USMLE Step 2 exam. And also this exam is getting done in Pakistan as well. I'm not sure, but if this exam is getting done in India, Bangladesh, or in Sri Lanka. But I know for the people of Pakistan, AMC MCQ exam from April 2025 is actually getting done in Pakistan as well. Important information is that this exam has sequential submission, which means that once you select an answer and click next, the response is recorded and you cannot change the answer anymore. And other than this, another issue in this exam is you cannot skip the example a question that, okay, I'll come back to this question and I'll have a look at this question again. You actually cannot do that. In the times when I gave this exam, we were able to review our answer. We were even able to skip the answer as well and go to the next question, come back to the question again. But I will also advise you, even in the times when we were able to skip the question, believe me, the exam pressure is huge. If you skip the question, there is a lot of chance that you will actually miss answering that question. So consider this as a blessing in disguise. I'm a very positive person, and I want you guys to stay positive as well. So after moving to the next question, you cannot go back to the previous question. You cannot review and you cannot change your answer as well. Now, in this exam, you can use various resources. John Murtagh is a general practice book, but it's more like a manual. It's more like a reference book. It's a very big book. And but along with that, there are handbook of multiple choice questions. There is annotated AMCQ, which is annotated multiple choice questions as well. Then there is a book of anthology of medical conditions. Along with that, there are MCQs from eMedic, Amadex. Then there is Canadian QBank as well. Then there is QBank from USMLE World as well. If you can see, this is the Canadian QBank. And I also want to let you know, I have come across some doctors who actually said that they actually did their preparation from the Oxford Handbook of Clinical Medicine, which is a book from UK. When I did my preparation of the exam, I actually used the book from the Kaplan series, USMLE Step 2 Clinical Knowledge Lecture Notes, and I benefited a lot from that. But I still used to keep the John Murtagh side by side. And if there used to be a little difference in the book of John Murtagh from the Kaplan series, I used to actually quote the answer of John Murtagh into my Kaplan series. The doctors or the junior the medical students who are sitting here, if they are planning for the AMC pathway, they can actually buy this John Murtagh's general practice book for their final year time. If they are reading, for example, Davidson or PJ Kumar, they can actually read this book side by side to get an idea about how the medicine is practiced in Australia. So these are the resources of the AMC MCQ exam. resources are not that huge like USMLE. Like for USMLE, there are a lot of resources like USMLE World, Kaplan series, but there are a lot of tuition academies. I personally think that for the competent medical students or the competent doctors, this AMC MCQ exam is very doable without taking any help. But this need of help can be subjective. You can decide based on your level whether you want to take help or not, and based on your affordability as well. But if you think you need help, this is highly recommended that you should take the help. Now, there are other resources as well, and these resources are extremely important. Therapeutic guidelines, we call them in Australia as small e and capital TG. Then there are RSCGP, Royal Australian College Guidelines. There is RSCGP Red Book. Then you can see RANZCOG. This is for the women's health. RCH's Royal Children's Hospital. They have the guidelines for the PEDS. You have to actually use these guidelines for all the exams in Australia, whether they are the licensing exams like AMC MCQ exam, or they are the clinical AMC clinical exam, or even if you are doing the fellowship exam for the general practice or the fellowship exam for the general medicine, you have to use these guidelines. The key to get success in these exams is you need focus, dedication, and hard work. Focus gets disturbed if you have some family problem. Like if somebody is married and has got marital issues, marital conflicts, if somebody has got financial issues, if somebody has a family where they have some unwell family members, obviously the focus will be disturbed. But according to every culture and religion, family comes first. If that is the case, just leave AMC. Focus on your family. Focus on your own priorities. Keep in mind, ambitions cannot overrule family and the religious and the cultural values. You need to be dedicated. Dedication does not only mean studying, but the dedication also means that you should enjoy the study. Try to achieve the excellence. When you are preparing for the exams, enjoy this, that, wow, I learned this today. And wow, this is so interesting. I'm learning every day. I'm learning new things every day. And you need to be hardworking. I usually tell the junior doctors as a general practitioner supervisor that being intelligent, being very talented is one of the skill, but being hardworking is a superior skill than being intelligent or being talented. So hardworking is a very precious skill. So I want every doctor and every medical student to be focused, dedicated, and hard work. But I do confess that sometimes due to some family barriers, some financial issues, focus can be disturbed. Then do something where you can maintain your focus if you cannot afford the AMC pathway. Once you have done your AMC MCQ exam, you have got 4 options. Now, I want to tell the doctors we might be releasing this video on the YouTube as well later on. But if you want to take the picture of these slides, I'm more than happy for you guys to take the picture. But I want you to go side by side with me during this journey of the lecture. So there are 4 steps after the AMC MCQ exams. First step is you can start applying for the hospital jobs. And you can, if you get the job, you will be working on the limited registration in the hospital. Or you can apply for the work-based assessment either before coming to Australia or after coming to Australia. But I want to let you guys know that at the moment, second part, work-based assessment before coming to Australia, is almost impossible. The first part is not impossible, but it is not very easy. The third step is, which is in my limited understanding, it's very doable. You can start applying for the general practice jobs, and you can come to Australia once you pass this PESCI exam. And the fourth option is, which you still have to do, whether you go to the first or third option, you have to prepare for the AMC clinical exam. It only gets exempted if you do the work-based assessment, which is not doable currently when applying from overseas. But there is one more option through which AMC Clinical can become exempted, and not many people know about that step. I'll come to that and I'll give that surprise later on. Job search. So let's come to the first step, job search. You can apply on the websites like Seek, LinkedIn, and Indeed. There are rural workforce agencies or RWA state-based IMG-friendly websites. Then there is another email address that I have written over here. This is the Rural Work Agency Network.com.au, rwanetwork.com.au. So you can apply to these websites. You should have contacts with the senior colleagues working in the hospital setups or rural general practice clinics. Otherwise, out of these places, if some doctor is working in the private hospital or if some doctor is working in the private general practice, they may not be able to help you at all. But the seniors and the colleagues working in the government hospital setups or working in the rural general practices, they can actually help you as well. For example, if you decide to go into the general practice directly, and if you know some doctor in the rural general practice, a principal general practitioner, they can offer you the job in the rural general practice. Once you have got the job offer, you can get the give the PESCI exam, and once you have passed the PESCI exam, you can straight away come to Australia. Credit to Emergency Focus for this page. You can actually apply to these websites for the job. I would like you to take the picture of this slide. But if we release this actually lecture on the YouTube, you can later on note that as well. Keep in mind that the jobs in demand in Australia are psychiatry, emergency medicine, general practice, which is called as family medicine is in United States. And then there can be unaccredited positions as interns or as resident medical officer. So there is a lot of demand for the junior doctors in psychiatry, in emergency medicine, in general practice, and in family medicine. But also keep in mind, if you come to Australia, it's not impossible to become a cardiologist, to become a nephrologist, to become an endocrinologist, to get ICU training. These are all possible pathways, but these are the easiest jobs available in Australia at this point of time. Applications, you can apply for the clinical observerships. I know that Emergency Focus, which is owned, the director of Emergency Focus is Dr. Rizwan Qureshi, who is my very good friend as well. They actually help the doctors to make the CVs, to make the cover letter. They actually prepare the doctors for the interviews, and they also help the doctors for the clinical observerships as well. Through them, actually, one of the doctor from India is going to join me on 13th April for the observership. And when you do the clinical observerships, keep in mind that your CV value starts going up, because then they get an idea that this doctor is getting to know about the system of Australia. You can apply for the internship positions. These might be difficult to get in. The easier jobs to get in might be the jobs of resident medical officers or senior house officers. So there are different terms used in different states. So in Western Australia, I think the term mostly used was resident medical officer, RMO. But in Queensland, at that time when I joined in Australia, the term used was SHO, senior house officer, but they are more or less the same. And in the Queensland, I think the internship job was called as JMO, something like junior medical officer, or JHO as junior house officer. And then principal house officer is called registrar in Western Australia. Probably this term might still be getting used in some of the states in Australia, PHO. You can also apply for senior registrar medical officer if you've got a lot of experience, but that might be very, very difficult. You can apply for the jobs as specialists as well, but I will come to that later. Now, how you can increase your chances of jobs in Australia? You should apply for the regional areas. Like in Queensland, just to quote some examples, there are areas like Mackay, Rockhampton, Bundaberg, Mount Isa. In Western Australia, there can be places like Kalgoorlie, Port Hedland, Bunbury, Albany. In New South Wales, something like Broken Hill, double these areas, they can be having a lot of jobs, especially for the general practitioners. In Northern Territory and Tasmania, the Caucasian doctors don't want to go. These are considered highly remote areas of Australia, but there can be availability of the jobs in these states of Australia. You can also increase your chance of getting the job in Australia if you have passed your AMC clinical exam. And along with that, if you have completed your USMLE exams, if you have completed your PLAB exams, and you combine your AMC1 exam with that, you actually, your AMC clinical exam gets exempted. But keep in mind, not many doctors and even the hospitals may not know this option, but it is mentioned in the Australian Medical Council website that if you have USMLE exams, if you have got PLAB exams, and once you have given AMC MCQ exam, actually you don't need to give the AMC clinical exam, but you have to do some experience, but I'll come to that part later. By doing the clinical observership, you can actually increase your chance of job, but also keep in mind, AMC exams, USMLE exams, PLAB exams, these are licensing exams. They make you eligible for the jobs, but they don't make you competent. Your competency is assessed by your experience. So this experience is very valuable. That's the reason I said in the very beginning, please don't waste the time. Start getting the experience once you have done the graduation. If you do some ALS2 course before coming to Australia, that is very good. Your superior English, that can also give you higher score than other doctor. I know one of my friend who had actually the score of 9 in IELTS in all categories. He actually got the job actually before every one of us. I think probably within 1 to 2 months. So having a superior English is a strength, but having superior English does not mean that you need to have Aussie or American accent. Your English should be understandable. Tips and tricks for the job, yes, CV and cover letter, interview skills, and personality. They don't like the doctors who have who look like to be in a bad shape or bad health. You should look smart. Again, I'm repeating, if you have a beard, if for your cultural and religious reason you wear some cap or some pagri, they don't mind that. But if you have skills to impress them, they will actually prefer a bearded doctor over the clean-shaved doctor, but you should be good in presenting yourself. Work-based assessment. This is the work in accredited hospital. There are GP roles for assessment of practical skills as well. They test your clinical skills, decision-making, and teamwork all over the duration of 12 months. So you are in the exam during the 12 months time. Outcome of this is you will get your AMC clinical exam exemption. You will get the AMC certificate, and ultimately that will lead you to the general registration. But the limitation is it's very competitive and it's very limited in number, though are they trying to open more of such programs. But also, I've never seen any doctor getting into this job directly from overseas. You need to come to Australia first. You need to get some job, then you can apply to these programs. Though this is not rule, but conventionally, I've not seen anybody getting into this job coming from overseas. So this is very important to know that this option is available, but this is not very gettable. Let's come to the AMC clinical exam format. This is an OSCE exam. OSCE means Objective Structured Clinical Examination. There are 20 stations of this exam, and they are 14 are scored. 2 stations are unscored, like they are like something like the same like the pilot MCQs. So they are not scored, but you don't know when you are doing the stations whether this is the station that is going to be scored or not. So you have to perform well in every station. There are 4 rest stations, which means that there are 20 rest stations, each of 10 minutes, and which means that there will be 10 minutes break as well between these 16 stations. Let's go to the next slide. And so what they test in the AMC clinical exam, they test your history taking skills. They test your physical examination. how you are formulating a diagnosis. They assess your management, counseling, and education to the patient. Cost of this exam is around 3,000 Australian dollar. This used to be conducted online as well via supervised video conference. The cost was a little more, but I'm not aware that this is getting done for through the video conference anymore or not. Even if this option is available, this option is available very limited. I think only for some few doctors working in the very remote area. You can consider this online supervised video option as not available. But also keep in mind, when you are giving the AMC clinical exam, you will feel actually more secure when you're doing it physically in front of the examiner, you will be able to show your history taking skills, physical examination skill better you are when you are in front of the examiner. Now, this is a bit of problem with this exam. AMC clinical exam pass rate is 21 to 24%. This is a bit of an issue, but I want to reassure you about this part as well. The pass criteria has recently been eased. Previously, you had to pass 10 out of 14, but recently they have made it easy that you have to now pass 9 stations out of 14 stations. You also need to know why there is such a low passing rate of this exam. Number one reason is that, look, there can be safety errors and critical errors. For example, you start taking the history of the patient, you do the physical examination, and when you prescribe some medication, you don't ask what is the allergy history of the patient. You are prescribing penicillin to the patient, and you have not asked the patient about the penicillin allergy or any medication allergy. They will fail you straight away. There can be communication gaps. The doctors coming from the non-English countries, they need to work a lot on their English. Another issue is Australian accent can be a little difficult. But the solution for that is start watching some Australian documentaries. And I will recommend you listening to some of the doctors and improve your English. And for example, if during the examination, there is some of the patient who say some Aussie slang, which you are not able to understand, just tell the patient, I'm really sorry. Can you please repeat this in the easy English so that I can understand and be able to assess you and give you the best possible management? Believe me, the examiner will give you some good marks for saying this. You have to manage your time. There are 10 minutes for each station, 2 minutes for reading this, the scenario on the door, 8 minutes once you are inside the room, during which you have to do history, physical examination, management, and counseling. And you have to divide this probably into 4 minutes, 2 minutes, 2 minutes, something like that. Many of the doctors give this exam with the half-hearted attempts. Some of the key of this exam is both having the knowledge and the technique. So if you don't understand the rules of the game, you cannot pass this exam. So once you have done your AMC MCQ exam, keep in mind the story is not finished. Half-life of the medicine is very short if you don't revise the thing. So once you have done the AMC MCQ exam, you need to remember all that theory so that you can apply this into the AMC clinical exam. Challenges are whether this is really a fellowship level exam because they test the real world scenarios. I personally don't agree with this, but I do confess it's a difficult exam. It's a little more difficult than USMLE clinical exam, which is not happening anymore, and the PLAB clinical exam. They test your body language, attitude, personality, and confidence. You need to have clinical knowledge as well as the communication skills. There are limited resources to do the preparation of this exam. And so if you will give the exam without completely decoding it, obviously you can fail. Australian accent can be difficult. So you need to listen to some of the Australian documentaries before coming to Australia. You have a lot of time when you are doing the AMC MCQ exam. In your break time, in your relaxation time, listen to some of the Australian documentaries to relax yourself, and at the same time, because that will also be giving you some preparation for the AMC clinical exam. But I want to let you know that this failure percentage is a little more because of some poorly prepared doctors. That is the reason this percentage is very low, between 21 to 24%. I recently communicated with Dr. Rizwan Qureshi as well. He actually said to me that encourage the doctors to prepare for this exam really well. You need to have a role player for this exam. This is actually my picture from the college days when we were doing the preparation for the ENT Viva. You need to have the role players. You need to practice this with the exam. If you remember how we play the computer games, when we keep playing that computer game, that game becomes so easy for us, and we actually do well in that computer game when we actually enjoy the game as well. So you need to enjoy the preparation for exam, and if you do all the things well, who can fail you then? The book for this exam is AMC Handbook of Clinical Assessment. That's the only resource. Along with this, the same guidelines that you need to use for the AMC MCQ exam, you need to use the same guidelines for the AMC clinical exam as well. But AMC clinical exam is how to apply that knowledge. So when you have done the AMC MCQ exam, you need to keep that knowledge. You need to keep revising your knowledge because you need to apply that knowledge into the clinical exam. And many times doctors also fail the exam because there becomes a gap between the AMC MCQ attempt and the AMC clinical attempt. By the time they come to this exam, their knowledge has become very weak and they fail to do the preparation of the multiple domains required in this exam, where you are being tested for your communication, where you are being tested for your body language, your how the way you are handling the patient, how the way you are showing the empathy, how you are breaking the bad news. All of these multiple domains are getting assessed on this exam. You need to be really well prepared. So when you start preparing for the AMC MCQ exam, you need to start preparing for your AMC clinical exam as well straight away. When you are talking to your friends, when you are talking to your colleagues, talk to them professionally. Stop using the slang language. Try to become more professional, even with your very close friends as well. I remember when we were preparing for the AMC MCQ exam, there were some friends of mine, and we used to say, let's try talking professionally with each other. Let's try to talk in a way that when we go to Australia, we are able to talk professionally with our colleagues, with our patients. So this is the way you have to prepare for this exam. In your times, I would like to say to all of you young doctors and the medical students, there are so many tools available as well. Like you can use this Obsidian tool that you can record your voice and you can make your notes through that. You don't need to write so many notes of yours. When you will use this Obsidian tool, it can organize whatever you say into the tool. It can actually organize that into the notes form. You can use this Anki Droid as well also to make the flashcards to keep memorizing and revising those small points of different topics like polycystic ovarian syndrome, like polycystic kidney disease, and along with that chronic kidney disease, diabetes, COPD. There are so many things which you need to keep revising. If you make your small flashcards, it becomes easy to revise those notes. Recalls, I would not like to discuss on that, but I've seen many videos available on the YouTube which mention about the recalls. But keep in mind, legally, you are not allowed to record the exam. Legally, you are not allowed to disclose the exam after coming out. But I think the recalls are still available. I cannot say legally about this. I don't know what is the official stance exactly of the RSCGP or AMC if that has changed. But look, basically, you need to prepare for the approach. You need to prepare for the knowledge as well as the technique for the exam. But I've heard in all the academies, they say that the recalls are very important. I also want to give the disclaimer. I'm not officially involved with these academies, so I cannot give a 100% statement on this. Now, let's come to this PESCI exam. This is our third option or fourth option where we can apply for the general practice directly after the AMC1 exam. But this for PESCI exam, you need to first have the job contract available. It is position specific. For example, if you've got the job offer for Dubbo and you have given the PESCI exam, you still need to have that valid offer available even after you have passed this exam. If you pass the exam and that practice from Dubbo tell you that we don't have the job available anymore, next step is whether the next offer, for example, you've got from Orange, which is also the countryside in New South Wales, you need to check with the authorities whether the exam that you pass, whether that is still valid for orange or not. So they test also the candidate's knowledge, clinical skills, and a successful result is valid for 12 months. After that, this exam is expired. There are 4 to 5 standardized clinical scenarios. Each, I think, clinical scenario is like a 60 to 90 minute online, something like that. It is conducted by the panel of 3 members. There can be 2 general practitioners, maybe 1 nurse, or maybe 1 social worker. So the passing rate of this exam is close to 50%. But I can tell you, if you are well prepared for the AMC clinical exam, you can even pass that exam as well. If you, for example, counted 2,000 candidates, so 20 to 25% means you need to be among the top 500 to pass that exam. So for this PESCI requirement, you need to have the medical qualification. Your AMC MCQ exam should be passed through the standard pathway, or you should be eligible for the competent authority pathway. You need to have the job offer before this exam, and your English should be really good. That can be one of the strong skills during this exam. PESCI resources again are limited. You need to take help. For both AMC clinical exam and PESCI exam, I will recommend that you should take help. Like there is emergency focus from Dr. Rizwan, who is my very good friend as well. I'll highly recommend that. Then there is this AMC clinical. This is, I think, Dr. Patak. He has got the job recently in 2022 after passing his AMC clinical exam in 2022. He had already passed his AMC MCQ exam in 2015. However, he passed his AMC clinical in 2022. He had a big gap of CV, but he got the job. He has mentioned his story on the YouTube. He's running this Learn Medicine website. He has a website. He has a channel on the YouTube. He is an AMC tutor as well. And I've listened to the videos of both Dr. Rizwan and Dr. Patak. They both are doing really very good job. Then there is another academy called MG for MGs. This is, I think, run by Dr. Amir. You can see the picture of Dr. Amir just under this picture of MG for MGs. I've heard some good feedback about these people as well. This is, I think, Dr. Neat. She has very good videos on the YouTube. This doctor at the very right corner, I think he has stopped doing the help for the doctors because I think he's busy in the specialization exam now. Along with this, there is also another academy called Academically. They also help the doctors to pass the exam. So you need to take the help, I think, for AMC clinical and PESCI exams. This is the standard pathway. This is just the summary. Either you can go for the standard pathway. You give AMC's 1 exam, either get a job on limited registration. Then you have to, once you pass the exam, you can get the general registration, but you need to have at least 12 months of supervised experience of the hospital. If you don't get the job, prepare for the AMC clinical exam. If you get a job, you will come to Australia under the provisional registration, and after 12 months of supervised practice, you will get the general registration, and then you can apply for the specialization either in the hospital setup or in the general practice setup. Competent authority pathway, I would like to mention, we have got 10 minutes. You can send your questions to the doctors, and I don't know whether we will have the time for the question, but I want to complete these slides. So keep in mind, in UK, there are no jobs available at the moment, but the cost of PLAB 1 is around £273, and the PLAB 2 is around £1,063, and the passing rates are more than Australian exams, 70 to 75% and 65 to 70% respectively. USMLE exams, they have more passing rates, varying from 68 to 70% for USMLE Step 1 for international medical graduates, and 88 to 92% for USMLE Step 2 and Step 3 exam. Along with that, if you have passed your Canadian and New Zealand and Ireland exams, you can be eligible for competent authority pathways. Most of the doctors know that if you have done, you become eligible for competent authority pathway if you have 12 months experience in Australia, 24 months experience in USA, or 12 months experience in Ireland, New Zealand, or Canada. Yes, that's true, and that will increase your chances of jobs in Australia. But people don't know that actually if you have just passed these exams and you, even if you don't have experience in these countries, and you have passed your MC1 exam, you don't need to give AMC clinical exam. And I am the example of that, because I had my USMLE exams and I didn't have to give the AMC clinical exam. So if you, for example, have passed these exams and you couldn't get the job in these countries, then you have, if you have done USMLE exams, then you will get your general registration after 3 years of experience in Australia. Or if you have done the UK exam, Canadian exams, Ireland exams, or the Canadian exams, then you will have to do 2 years in Australia and you will get your general registration. Then there is also a channel for the specialists who have done the subspecialization. So that is called Specialist International Medical Graduate Pathway. I will very briefly mention about these. There is Expedited Specialist Pathway, Fast Track Pathway, but this is only for the doctors from UK, Ireland, and New Zealand. If they get the job, they have to do only 6 months in Australia under supervision, and after that, they get the specialist registration. Specialist recognition for the international medical graduates from other countries, if they have done FCPS or MD in medicine, surgery, radiology, gynae-obs, psychiatry, they actually can apply to the specialist colleges. They will be either getting the answer as partially comparable or substantially comparable. If partially comparable, then they will get there. Then they have to work in Australia in under supervision for 24 months. If substantially comparable, they have to work in Australia for 12 months, and then they will get the specialist registration. However, if they fail, then they won't be able to get into Australia. It's very competitive. I want to warn for the difficult specialties like dermatology, like for the ophthalmology, it might be very difficult, or maybe for ophthalmology, it might be close to impossible, but not impossible. Other than that, there is also for the specialist, there is specialist area of need, where you can directly get the job straight away without any assessment. But later on, you still have to combine this with specialist IMG, the second part mentioned over here. Surprise for the doctors in Pakistan, India, Bangladesh, and in Arab countries. If you have done MRCGP from South Asia, that is recognized in Australia, that is recognized by the Royal Australian College of General Practice, you will be assessed as partially comparable since March 2023. You can come to Australia, work under the practice experience pathway. GPs with MRCGP South Asia can work under level 3 and progress directly towards FRA CGP fellowship without AMC exam. This is high demand at the moment, because there is severe shortage of the general practitioners in regional, rural, and remote areas of Australia. When they come to Australia, they can straight away start getting the earning as a specialist general practitioner. They can earn around between $150,000 as a start, and their salary can go up to $350,000 to $450,000 per year. Limitations are they have to work only in MM2 and MM7 areas. They need to pass the FRA CGP exam. I have written actually within 2 years, but I just talked to one of the doctor who is on this pathway. He said that there are 6 attempts available irrespective of the 2 years time. Just the correction about this website. The picture on the left side that you can see, that is from the practice where I work. It's Emerald Hills Medical Center in Leppington. So this is the summary of these pathways. On the left side, the lower 2 pathways are for the doctors who are non-specialists and junior doctors. They can come through the standard or the competent authority pathways, or the specialists, they can come through the specialist and the area of need pathway. You can go through these slides later on. So summary is that if you come after AMC1, you will start working on limited registration. If you come after AMC clinical exam, or after AMC1 or PLAB or USMLE exam, or even after PLAB or USMLE exam, you can work under the provisional registration. After 12 months of supervised work, once you have passed your AMC clinical, or you have completed all your PLAB or USMLE exam, then your MC clinical exempted. After 12 months, you will get general registration. You do need clinical rotations of 8 weeks in emergency department, 10 weeks in general medicine, and 10 weeks in surgery. After getting the general registration, you can start your journey towards the specialist registration, which you will obviously get after passing the fellowship exam. Deep messages that it's very doable, but with hard work, focus, and dedication. According to AMC survey of November 2024, more than 4,000 of the international medical graduates, they did mention 77% of those doctors mentioned that it took them more than a year to complete this pathway, which means that 77% doctors are actually successful in more than a year. Remaining 23%, probably if we divide it even in 50%, so 12.5% doctors are still successful, maybe in less than 1 year. Maybe out of those 12.5 doctors, 12.5% doctors might not be successful, but that I'm saying anecdotally. Long-term plan, but it's a long-term plan, but it has realistic expectation. So this is very important message to take on. PR requirements, I'll not spend too much time on this. Once you get the general registration, you can apply for the PR as a junior doctor, even from the hospital setups, whether you are working in metropolitan or rural area. But as a general practitioner, you can only apply for the permanent residency if you are working in the rural areas or the regional area. You can apply for the PR pathways through the skilled immigration or through the employer-sponsored pathway, but your age should be less than 45. But the doctors coming on the specialist pathway, they can check for from the immigration consultants or from the principal general practitioners or from the hospital directors. If they are more than 45, there is still some pathway for getting the immigration, but they need to check from the authorities. You get the citizenship after a total of 4 years of stay in Australia, but the last 1 year should be without any travel. If, for example, you apply for the citizenship after staying in Australia for more than 6 years or 5 years, you still need 1 year of constant stay in Australia to get the citizenship. When you are coming to Australia, you need to learn what is general practice. There is one of my lecture available on the YouTube page of the channel of Emergency Focus of Dr. Rizwan Qureshi. Do listen to that lecture to develop some taste of general practice. Listen to, watch these videos like Dr. Mike, MedBros, Dr. Schwab. I like this Dr. Glockham Flecken. He's nowadays doing the videos along with NEJM. So he combines the humor with the clinical knowledge. I like this Dr. Vishal Gabel as well. And then you can see on the left side, you can watch some of the documentaries or the stories of the emergency from the hospital. And there is a page on Facebook, TLC Australia, something like that, or Untold ER Stories with the hash. You can actually watch these videos. These are really interesting, and you will develop the interest for the emergency medicine and the general practice by watching by listening to these doctors. This is my journey. I graduated in 2003. I initially gave USMLE exams, USMLE step 2, step 1, step 2 clinical knowledge, step 2 clinical skills from 2004 to 2007. I could not get the residency. I gave AMC 1 exam in 2010 and I failed my AMC clinical in 2012. We didn't have much information. Then some doctor told me about USMLE step 3. I gave USMLE step 3 in 2013, passed, got my general registration based on that, didn't have to give AMC clinical exam again. I did my MRCGP in 2022, working as a supervisor since 2024. I'm also doing the psychological counseling since 2024. I recently completed my diabetes diploma in 2025, and I'm about to complete my MSc after completing my research project just in upcoming September. That's in process. So I have a plan to keep growing as well. So I am likewise a student like you guys, at the same time working as a specialist general practitioner or a fellow general practitioner in Australia. And but at the same time, I'm a student as well. I'm still going with my journey to keep excelling in this journey. So if you guys have any question, I don't know whether we have the time to take the question or not. Usman or Taha, is there any possibility that we can restart this process again quickly so that all these doctors can join, or otherwise we can answer these questions later on? If they put those questions under the YouTube, I can give my answers to Usman or Taha, and they can give the answers to you guys. Sir, Usman, hand over.
Create another meeting if you want, if you are available.
Yes, I am available if all the rest of the doctors are interested as well.
Okay, sir, I'm creating a meeting and we will share the link in 2 minutes, inshallah.
Okay, Usman, give me a few seconds. I'm just trying to send this link to the doctors who were connected through me. Okay, give me a few seconds.
Okay, sir, we are waiting.
Okay, because we have got a little more time, I just want to go back to few important things. Just give me a few seconds and then we'll give the time for the questions. And all right, can you doctors see my screen?
Yes, sir. We
Hello?
can.
Yes, sir, we can.
Okay. Okay, just give me a second. Okay, so look, these are the references from where I took the information. So you doctors and the medical students can take the information from all these places as well. amc.com.au, AHPRA website. Emergency Focus is one of my very favorite. Dr. Rizwan Qureshi is doing an excellent job. Then this AMC Clinical, these two are my very top favorites. Then Medline Studio, they have got very good informational video. learnmedicine.com.au. Along with that, Dr. Reep. Then there, I've taken the information from Regional Work Association. I've written mosque next door, but I think that was some of the slides when I used some of the information in my presentation in National Medical University. Look, important part is that we really need to know, we need to have the knowledge, we need to know the rules of the game. It's a very doable, but again, what I will advise to you doctors is, you guys know that what are your circumstances, whether you can do it or not. I've given you the details of all the costs. Just to sum up about that competent authority pathway, obviously giving PLAB at the moment is not useful because there are no jobs available in Australia. Even some of the doctors are actually claiming why UK is still offering that PLAB exam. It's a bit unethical, but I'm not, I don't want to comment on that because there might still be some rare jobs available, but at the moment there are no jobs available. To sum up, what I advise to the doctors is, I'm just going back to my journey. And so this is actually, so this is just the summary. And if you come to this part, so standard pathway is basically giving AMC MCQ exam, AMC clinical exam. You need to have the job, you need to have the IELTS or PTE exam before the job. And so after that, you can work on the limited registration. After 12 months of supervised practice, you get the AMC clinical certificate. Once you have completed all the rotation, you will get the general authorities pathways. When you actually combine the PLAB exam, USMLE exams, or exams from New Zealand, Canada, or Ireland, and your AMC clinical exam gets exempted. Many of the doctors think that it is compulsory for the competent authority pathway to have the job experience from United States, from Ireland, or from Canada. But I can tell you, I talked to Australian Medical Council directly when I was in this process. So when I failed my AMC clinical exam, I actually talked to talked to Australian Medical Council, and they guided me that by telling that you need to have experience of 2 years of 1 year of UK, 2 years of America, and 1 year of New Zealand, or 1 year of Ireland. They actually also accept the experience from South Africa, from Ireland, from New Zealand. So after that you can work for 1 more year in Australia on provisional registration, and then you will be getting the general registration. But the lady who talked to me, she explained to me that because you have done all your USMLE exams, if you just complete your USMLE step 3 exam as well, you actually need to work in those accredited hospitals which are recognized in Australia. So if you're already in Australia, because of your USMLE journey, you need 3 years of working experience in Australia and you'll get your general registration. So I completed my USMLE Step 3 exam in 2013, and I got my general registration at the end of 2014. And in 2014, I came into the general practice. So this is what I want to mention for the doctors who have done specialization in Pakistan, India, or Sri Lanka. These left two top pathways, specialist pathway or area of need pathway, they actually need to apply to the specialist colleges for the assessment. After that, either they will be counted as at comparable path, either as substantially suitable or comparably suitable, like substantially comparable or partially comparable, and they have to do 12 or 24 months of supervised work in Australia respectively, and then they can start working as a specialist doctor in Australia. This MRCGP South Australia at the moment, it's a big luxury. If you have already done MRCGP in from South Asia, you are considered as partially comparable. You just need to apply the jobs in Australia, and this is since March 2023. So some of your seniors and colleagues who have done MRCGP South Asia, you can actually let them know. But after coming to Australia, they still need to pass their FRA CGP exam without the need of AMC exams. And this is high in demand because of the severe shortage of general practitioners in regional, rural, and remote areas of Australia. Come back to this. I do want to mention one more thing. Give me a second. Specialist general practitioners. Oh yes, I'm coming back to this option of the PESCI. So look, this is another way of going into general practice directly, that you have given your AMC MCQ exam. That's the reason I said you need to be in touch with the doctors who work in the rural or regional areas of Australia as general practitioners. If you get the job offer from the general practice in Australia, you just need to pass the PESCI exam, and you can straight away start working in Australia under level 1, level 2, according to your assessment on PESCI. And once you come under level 3, you can start having your general practice training as well, or probably you can actually start having training from the beginning. Let me correct myself. But yes, once you come on the MRCGP pathway, they do some of your interview, and I think you can come start working as level 3 straight away, but you need to pass your FRA CGP exam. I know some of the doctors who are working on this pathway, and they are doing extremely well, and they are very happy. I think this is one of the very quick pathway available in Australia. But keep in mind, Australia is a small country in terms of population. Area-wise, this is a very big country, so the rules keep changing. So if you are one of the junior doctor, and by listening to this video, after graduation, if you start making plan of MRCGP South Asia, obviously it's going to take you some time to complete this process. And by that time, for example, after 3 years or 4 years, you have completed your MRCGP from South Asia. And after 4 years, when you apply through this channel is not existing anymore because their need of the general practitioners is completed. Another important thing is about the research and the academic experience. I will recommend that. In our times, when I graduated in 2003, we did not have much information, but now there are a lot of informations available in YouTube. This world has become a global village. The benefit of all these channels available online from all over the countries, you can actually learn how to do the research projects. And if you have at least 1 or 2 research projects, some meta-analysis, or if you have done help in some project of research by doing some data collection, and if there is your name present in some of the journal article because you contributed in that, that can really work well for you. If you come to Australia, you need to understand what is the attitude of working as a general practitioner or working as emergency physician in Australia. Just keep in mind, when you are doing your study in a college, what are you learning? You are learning everything. You are becoming a generalist. So when you graduate, keep in mind you can be a very good general practitioner at that time, because when you have completed your final year exam, you have got a lot of knowledge. Do listen to this video present on YouTube to understand the attitude of working as a general practitioner in Australia. When I came to Australia, I did not even used to like this word GP. Why? Because when I was in Pakistan, I used to think that general practice is a field where you do graduation, you to complete your internship or house job, and you straight away start working as a general practitioner in community. That was the concept in Pakistan. Probably that concept is still there in Pakistan, but I can tell you, even slowly and gradually, this concept is fading away. There is FCPS family medicine available in Pakistan as well. I can tell you something to be very proud of. There is a family medicine consultant called Dr. Farida Amin. She has written one article on general practice in Pakistan, and that article has been published on the website of Royal Australian College of General Practice. We should be proud of the doctors like Dr. Farida Amin, and she's trying to. Yeah, she's trying. Somebody can close their mic, please. Yeah, so she's trying to introduce family medicine culture and the general practice culture in Pakistan. When you are working as a general practice in countries like America, Australia, England, New Zealand, you are working as a family medicine consultant. You are working as a family physician. You are working as a fellow general practitioner or a GP consultant, and you are the first one in the community to be contacted. You need to know almost everything. So watch this video to understand the attitude of working as a general practitioner in Australia. Along with this, listen to these doctors. Dr. Mike over here in the middle at the top. This is Dr. Mike. He is a family physician consultant from United States. He has done American diplomat. He's an American diplomat of family medicine in United States. Listen to his videos. Highly recommended. And that will help in improving your English as well. It is not necessary to make the accent specifically an Aussie accent when you're coming to Australia. Even if you have a good English with the Indian accent, with the American accent, or even with the Arabic accent, but your English is understandable, then Australian masses, they will fall in love with you. The patients will be in love with you for being caring, for being empathetic, and for listening to them and giving them the help. It's a very respectable job working as a general practitioner in these Western countries. Then this doctor in the middle, this is a Pakistani doctor, I think Dr. Suhaib or Dr. Shuaib. He has a page on the Facebook with the name of Med Bros, probably on the YouTube as well. He's extremely good. Dr. Glaucom Flecken is the ophthalmologist. He has some funny videos, but at the same time, some take-home message. So nowadays he's doing his videos with NEJM. So he has combined clinical knowledge with humor. Listen to him. On the left side, you can actually see I have taken the snapshot of one of the documentary from Facebook, and this is a page from TLC Australia. So if you actually look at this page, there are a lot of interesting stories available, and you can understand the attitude of working as an emergency doctor, emergency resident medical officer, or emergency physician, and that can help you a lot. Dr. Vishal Gabel, he has extremely good videos. He has an Indian accent, but I really like his videos a lot. So these are really good videos to listen to. Very important part to also to understand it. If you have subspecialty interest, like you want to become cardiologist, you want to become nephrologist, or you want to become endocrinologist, rheumatologist, these pathways are not impossible, but obviously they are more competitive than emergency medicine and general practice. If you go into the hospital setup, these are still doable if you do actually very well during your hospital rotations and you do some research work as well. It is very easily doable. And in our times, many of the doctors, even they actually got the hospital trainings without even any research experience, but they still got the jobs. There are some of my colleagues who became medical oncologists. There are some of my colleagues who became hematologists. There are many of my colleagues who became endocrinologists, renal specialists, pulmonologists, and ICU job is very easily gettable. And but there is a training of 6 years in Australia for ICU. These specialties are available, but to get into these specialties, first you need the hospital job. At the moment, the problem is the doctors from the Australia, UK and Ireland, they are applying for these jobs. So the reason of difficulty in getting the job in the hospital setup is, number one, there are a lot of graduates of Australian colleges. So they are trying to do some calculation for those graduates when they will be upcoming in the future. Along with that, they are getting some doctors from the UK and Ireland because of the saturation in these countries and not the very good situation in these countries of the job. That is the reason there are a lot of doctors from from UK and Ireland. They are applying for the jobs in Australia. And when they are getting the job applications from these doctors from Ireland and UK, actually they get the doctors who are already trained for the Australian setups. That is the reason it is becoming difficult for the international medical graduates from Pakistan, India, Sri Lanka, Bangladesh, and Arab countries to get the jobs. But it is still doable. Keep in mind, many of the Caucasian doctors from UK, Ireland, South Africa, they are actually not applying for the job in the rural areas of Australia. So you can still actually apply for the job in the rural areas. There are still jobs available, probably in the hospital setups as well. This is the picture from Port Hedland, where I also worked, I think, for around 4 or 4.5 months as a medical registrar in Port Hedland Hospital. It was also called as Hedland Health Campus, and I really got a very good experience. You also need to understand the culture about Aboriginals. This country, Aboriginals are the native Australians, and this country actually belongs to them. Before every ceremony and at the end of the ceremony, Australian government and Australian officials, they actually give respect to these Aboriginals. And so you need to learn the history about these Aboriginals as well. There are some controversies available as well, but let's be positive. Let's see how the Australian government is trying to help these Aboriginals now. And you need to understand the Aboriginal medicine. There are a lot of questions about Aboriginals. For us, for the doctors like from Pakistan, India, and Bangladesh, or from Sri Lanka, from these South Asian countries, keep in mind, Aboriginals have actually got all the health problems, same like Pakistanis and Indians. If you see some person from Pakistan and India, somebody in the age of 60s, you will see the history of stroke and heart attack, and you will see the history of heart attack and stroke among Aboriginals in the ages of 40, and you will be surprised. I've seen a patient, an Aboriginal patient with the stroke at the age of 27. I've seen a patient of myocardial infarction at the age of 30 in the Aboriginal community as well. So you need to understand the Aboriginal medicine as well. And so I'm just coming back to my journey again. I actually had done my USMLE exams. I could not get residency in Australia. Obviously, I'm not a robot. I'm not a machine. I was upset, but I didn't, because I'm a positive person, I started working in Australia. I started working in Pakistan. And I was doing extremely well. I did not have any intention to come to Australia, but then I got injured and I fell from the height of 30 feet, broke my ankle and my back. I had a fracture in T11 and L1, and I had the displaced fracture in my right ankle. I needed the surgery. Luckily, I did not have to go through the surgery for my back. And that was the time I was advised to prepare for AMC exam. So I did my IELTS exam. I completed my AMC MCQ exam in 2010, and I got the job in 2011 in Australia. I came to Australia in 2011 January, and then I got the job in May, and I started doing my job in August 2011. So I still remember I had to give my AMC clinical exam on 23rd June, which actually got failed due to some unforeseen circumstances. I was moved from Port Hedland back to Perth again. I didn't have the home, didn't have the car. And in last 3 to 4 weeks before the exam, rather than prepare for the exam, I got into all those troubles, failed the exam, but maybe that was a blessing in disguise, because at that time I wanted to do the hospital specialization. Then I did my USMLE. I was actually unable to get the date for AMC clinical exam. I did my USMLE Step 3 exam in 2013. Came to, after coming to know about the competent authority pathway, and at the end of 2014, I got my general registration. By then, actually, it had become difficult to apply for the hospital specialization pathway. But I will come back to this general practice again. I want to tell you general practice is a proper recognized pathway. Don't feel depressed if you're coming through this pathway. Oh, my friend or my roommate of the college or my other colleagues, they are becoming cardiologists or nephrologists in India or Pakistan, and I'm working as a general practitioner. This inferiority complex is not existing in Australia, and we should neither have superiority complex nor the inferiority complex. Working as a general practitioner in Australia is something to be proud of. It's a very good specialty. And by watching this video on YouTube, you can understand what I'm trying to say. And it's not only emotional for me to tell you how beautiful is this practice, but in a very technical way, I can tell you, if you really want to enjoy medicine in Australia, working as a general practitioner in community, that is one of the best way to enjoy the medicine. Why? Because you are the one who diagnosed celiac disease. You are the one who diagnosed the inflammatory bowel disease like ulcerative colitis and Crohn's disease. You are the one picking up COPD and asthma cases. You are the one actually to pick up the bladder cancer, kidney cancer. Most of the cases are actually, more than 90% of the cases are already diagnosed by the general practitioners by the time they go to the hospitals. So as a general practitioner, you have to treat a lot of medical conditions. Like, I'll give you just the example of celiac disease. As a general practitioner, if you suspect that somebody has celiac disease, you are allowed to do the testing for the celiac disease. You will do the celiac screening. If the celiac screening comes back positive, then obviously you can tell the patient to stop taking the gluten diet. You will refer the patient to the dietitian. Once the patient stops taking the gluten diet, patient will get better. You have already done the treatment. Obviously, you will refer the patient to the gastroenterologist for the scope. And before getting the scope, you will tell the patient to give the gluten challenge of around 6 grams of gluten and you have to do this in 2 weeks' time. You will tell the patient to take 4 white breads every day, so that by the 2 weeks' time, there is enough gluten challenge, so that by the time they get the scope, they have got the visible villi present in their gut. And then the doctor the gastroenterologist who does the scope can see those villi and can take the biopsy and prove that the celiac disease is present there. So the gastroenterologist only needs to prove it. After that, the patient will still come to you, and you will be monitoring the celiac antibodies every 6 months. And you will also monitor this patient for the autoimmune conditions like type 1 diabetes, which is, not the type 1 diabetes, like diabetes. So when the celiac disease patient get diabetes, that diabetes is called latent autoimmune diabetes of adult. These patients can develop Hashimoto thyroiditis as well. They are at risk of developing some of the autoimmune conditions. These patients are at risk of developing osteoporosis. As a general practitioner, you will be doing all these things for your patient. Along with that, if some patient comes to you with hematuria, you are the one to decide whether you have to treat the patient at general practice, whether this patient needs to see the nephrologist or the urologist. You will be the one to do some investigations and then get to know what is the cause of hematuria. If some patient comes to you as a general practitioner, you need to know whether the patient who has come to you with the problem in the eye, if the patient has bacterial conjunctivitis, you will treat it at general practice. Even if it is chlamydia trachomatis, you can give oral azithromycin. If it is a routine bacterial conjunctivitis, you will give either the chloramphenicol eye drops or the chloramphenicol ointment. If this patient has got some mild condition like subconjunctival hemorrhage, even that patient has to be treated in the general practice. You won't do the referrals for these issues to the ophthalmologist. The ophthalmologist will get a very bad impression of the general practitioner who is referring the patient of the eye condition to the ophthalmologist for the subconjunctival hemorrhage, for the conjunctivitis. But obviously, if there is a conjunctivitis from the herpes zoster, then that can be leading to shingles at eyes. and which is an emergency, then you have to send the patient to the hospital. So you need to know as a general practitioner, and you are doing all these things and you are studying all these things in the final year. So let's come to the questions now. And I will stop sharing my screen and we can start taking the questions. There are many things to tell you, really, but I think we have to move to the questions now. And let's start taking the questions, and you can send your question through writing or
If anyone has any question, he can write in the chat. She can. Sir,
Taha and Usman, sorry to interfere. I'm still available.
sir, are you
Okay,
there?
we can start taking the questions now.
Okay, everybody, please don't unmute your mic. We will take question one by one. So,
Okay, and just one request: no political questions, no religious questions, only the questions related to the medical science, related to AMC pathway.
sir, first question
That's
is
a good question by Mudassir Javed. Okay. Oh, yeah. I actually was about to mention this. So, look, when you are working if you want to come to Australia and you are working in Pakistan, you need to have experience during the house job in general medicine, in surgery. If you can also have the experience in gynecology, obstetrics, psychiatry, and in some of the subspecialties that will really help you when you come to Australia. However, you still need to prepare for the exams. This style of first preparing for the exams and then coming to and then start doing the job and showing a big gap in the CV, that's not recommended anymore. I won't advise anybody to make a fake experience. For example, if you show in your CV some fake experience, you come to Australia, if they start asking you the questions, for example, you show that you have been working in pulmonology for 6 months and then ICU for 6 months, if they start putting the questions to you, you will get into trouble. You really need to show on the CV what is really there. But to come into the general practice, the specialties that I've mentioned, like in emergency medicine, even if you are working as a general practitioner in the community, if you are working in the hospital setups in the specialties like general medicine, surgery, psychiatry, gynae ops, like some 3 months experience in all these specialties for the general practice, that is considered actually extremely good, and even in pediatrics as well. Next question. Taha, if you can read the questions for me, that will make it easy for me because I can see that the questions are coming.
Okay, sir. Second question is importance of MRCP, MRCEP in specialist pathway if someone has not done FCPS MD.
Look, MRCGP South Australia, that is only recognized in Australia, or MRCP from UK if you are working in United Kingdom, if you are working in England. Otherwise, there is no other MRCGP recognized. There is no value of MRCP in Australia. However, that this is not recognized to get to make you eligible for the job. You still need to give AMC exams, but MRCP, that will actually increase the value of your CV because you have done some good exam, but that will not make you eligible for the job without the AMC exam. However, if you have done FCPS medicine or FCPS surgery or FCPS radiology or FCPS gynecology, as I already mentioned in my lecture, you can actually apply through the specialist pathway. But MRCP is not counted in that pathway. But if you have already completed your specialization in England and you have completed your FRCP as well, I think, then you can come to Australia and you can work for 6 months under supervision, and then straight away you can start working as a consultant. But I think most of the doctors participating in this who are present at the moment, I think they are not from any of such category.
Okay, sir. Second question is, sir, after all these exams, it means that you have got permanent registration like after AMC2. residency starts after that? Like he is basically trying to ask about residency pathway, like how much it will take to.
Okay, yes, that's a very good question. Previously, look, in the times when I came to Australia, there before even that, before 2010, doctors used to get the training positions uh, even after passing AMC1 exam and getting the jobs in the hospital. But now this is not happening anymore. You have to clear AMC clinical exam to get general registration, and then you can apply for the training positions. And so you during that time you are working at the non-training position, but you are still getting the learning.
Sir, next question is surgery
Hmm.
possible in Australia, as I have heard that Australia usually take their own graduates for residency in Australia?
Okay, getting the training in the surgical position, it's not impossible, but it's one of the most competitive specialty. I know some of the doctors who tried in orthopedic surgery, who tried in urology, but ultimately they failed. But I know some of the doctors who actually got the job in surgery, but before that, they actually did the non-training job for close to 10 plus years, and then they were able to get the training in surgery. So it's a highly competitive pathway, highly competitive specialty. If you are very competent, if you have got a lot of motivation, yes, when you come to Australia, you can start working doing the surgical rotations if you do a very good interview. But getting the training post, that will take a long time. But let me tell you one example. I know one of the doctor who is now a surgical consultant from Australia. He got the job after 10 plus years of non-training jobs. Later on, I asked him to give the interview for Dr. Rizwan Qureshi. He refused to give the interview, and he said that I think I wasted my life and I will not advise other doctors to do this. But that depends from person to person. And if you have too much dedication, it's up to you. I don't have the right to stop you. But keep in mind, there is a chance as well. There is a lot of chance that you may get refused for that.
Sir, next question is from Frishta Liaquat. Sir, can you work as op gynae in GP setup, or is there any value of GP aesthetics in Australia?
I will come to that. I have just seen the question from Moaz that, yes, Moaz, I already mentioned it in the lecture that after PESCI as well, you still need to pass the AMC clinical exam. Okay, Dr. Farishta Liaquat, I can answer her that, look, when you come to Australia, if you come, for example, as an MRCGP, uh, uh, after doing the MRCGP from South Australia, if you come to Australia, you can work as a general practitioner. If you have expertise in the gynecology and obstetrics, you can actually use this experience to manage a lot of patients, a lot of female patients, to help them with their fibroids, with their endometriosis, picking up a lot of clinical cases. But there might be some limitation in doing some of the procedures. However, if working in Australia, if you get into AGPT training of general practice and you do the training in the gynecology and obstetrics as well, you are allowed to do the cesarean sections. You are allowed to do some of the gynecological surgical procedures. But if you come through MRCGP pathway, there will be a lot of limitation. You first need to do some certifications. These are a bit of competitive general practice pathways, but they are still gettable, not impossible. But look, as a general practitioner, when you work in Australia, you will still be able to help your patients. Like I know one of the doctor who is working in Australia as FRA CGP general practitioner, but she has also done FCPS in gynecology and obstetrics in Pakistan. She's not going beyond her capacity in Australia, but she's still able to help a lot of gynecology patients, and she's famous in Australia to work as a general practitioner with special interest in women's health, because she has got a lot of knowledge, and she helped a lot of female doctors in that. But obviously, there will be some limitations in doing some of the procedures.
Okay, sir. Next question
Yes,
is,
next question.
can you break out approximate years to reach consultant position? Like in USA, they first have match, then residency 5 to 7 years, then further subspecialties of 2 years. Like he's approximately he's trying to ask a total duration during to reach the consultant level, basically.
Easy. So look, I know about America. Look, in America, there is no concept of non-accredited training positions. You actually go straight to the training position. America is very well structured. If you can afford, I think you guys should go to America. And recently, if you know that this year, 150 doctors matched for United States from King Edward Medical College, around 42 doctors matched from Nishtar Medical University, and around 5 doctors matched from Dera Ghazi Khan. There's some medical college over there as well. So they have very structured training system. When you get the job in Australia, the first 3 years in internal medicine, you actually complete those 3 years, and straight away after that, you can work as internal medicine specialist. You can either work in the hospital setups as hospitalist, or you can work in the community as internal medicine specialist, and you can take the patients directly as well. And as internal medicine specialist and the family medicine specialists, they actually also can work in the community like general practitioners in Australia, England, in Ireland, and in South Africa or in New Zealand. So in America, then yes, after 3 years of internal medicine residency, then if you go into the subspecialty, varying from subspecialty to subspecialty, after 2 years to 4 years, then you become a fellow consultant. So, but if you don't want to do the subspecialty, you can work as an internal medicine consultant in America. So American pathway is very well structured. Australia, England, and Ireland, they are not well structured like America. In these countries, like in England and Australia, first you have to work in the non-training positions. But in terms of lifestyle, I might be a little biased, but I can tell you, I've gone to America as well a few times. Australia is much better in terms of lifestyle.
Sir,
so that's up to your priority. But if you can afford, I think America should be your number one priority. That is my unbiased advice.
Okay, sir. Next question is, what is the route of specialty training in Australia? Like, realistically speaking, what is available for EMGs, basically? I think.
Yeah. So look, once you have come to Australia, you have got 2 pathways. Either you will come into the hospital setup, or you will come into the general practice setup. So once you come in hospital setup, so once you have completed your AMC exams, you can apply for the hospital trainings. And hospital training in general medicine is called BPT, Basic Physician Training. But you need to have general registration. In terms of duration, look, it can vary from doctor to doctor. If you pass your MC clinical exam very quickly, or if you come to Australia straight away, like if you get the job in Australia after passing the MC clinical exam, you only need 12 months of supervised job experience in hospital setup, and after 12 months you will get the general registration, and straight away you can apply for the specialization. And if you come into the general practice pathway, you can actually get into the general practice specialization program straight away as well. Taha, just be careful. Some of the questions that I can see, they are already the questions which we have mentioned in the lecture, so you can skip some of the questions because you are attending my lecture second time.
Okay, sir.
Next question.
How can, like, it is a general question, how can we improve our CV to get a job after AMC? Like researches, ATLS, BLS workshops, and any other things you want to mention? Like,
yes, I'm answering the previous question as well. So I mentioned about America, but for Australia, the time duration can vary from person to person depending on how quickly you pass your AMC clinical exam. So it can be, I know if the doctor come to, for example, hospital setup after clearing AMC clinical exam, probably after 1 year, if they get into the specialization position, probably in the next 5 to 7 years or 5 to 8 years, they will be working as a consultant in Australia. And general practice is a little shorter pathway. If you actually complete everything with the GP training, actually you can be working as a GP specialist in the next 3 to 5 or 5 to 7 years, depending on how quickly you complete your clinic licensing exams or complete your FRA CGP exams. And okay, what was your last question, Taha? Yeah, improving CV. Yes. Look, that is again the same question which I've mentioned in the lecture, that you can improve your CV by keep working, improve your academics. I've already mentioned some of the specialties where you work. Your CV is considered your CV value increase. So you have to keep working. Gaps in the CV are not considered good. For example, if you show a gap that I was preparing for the AMC exam for 1 year, that is not considered good. These gaps are not advisable.
Sir, can you
But
please?
it is still not impossible to get the a job in Australia with the gap. I mentioned about one of the website or the channel on YouTube, AMC Clinical. Dr. Patak, actually, he cleared his AMC 1 in 2015. He was, I think, living as a student in Australia. He was doing masters in some subject. And then in 2022, he completed his AMC clinical exam. And after that, he got the job in the general practice. And now he is doing the general practice training.
Sir, can you please elaborate a little bit more about observerships, volunteerships as well? Like they carry a weightage in CV or not? Like as an
This can be the best thing that you can do about yourself. One thing that I would like to clearly mention, that look, it's a game of how much money you put in. So you need to be little rich to apply for this program. And if, for example, you have cleared your AMC1 exam, as I said, for the AMC clinical and for the PESCI, you need to apply for the academies who can help you in passing these exams. They really prepare you well to know the knowledge of the game and the rule of the game. And there is a lot of chance, if you are competent, if you are hardworking, if you are a good student, it will help you passing the exam. Next thing is, after you actually pass these, so you need help. Now, if you get the clinical observership, obviously that will increase the value of your CV, because the person who will look at your CV, he will see a hard work, that he has not only cleared the exam, he is not only having the experience in Pakistan, India, Bangladesh, or Sri Lanka, but he has also done the clinical observership in Australia. So he has learned how the general practitioners work in Australia, how they refer the patients to the hospital, how they manage the patients in the general practice, how they use the allied health specialists like the dietitian, physiotherapist, occupational therapist, the social workers in Australia, how they refer the patient to the emergency department, how they decide whether to refer the patient to emergency department or to refer the patient to the hospital setup or to refer the patient to subspecialist. I think clinical observership is one of the most important experience that you can add in your CV. And that is of crucial importance if you can do that. Emergency focus is helping the doctors to get the clinical observerships in Australia.
Sir, what about workshops like ATLS, BLS workshops? Like there are many local hospitals in Pakistan, like Mukhtar Sheikh Hospital, which is do training, which offer training in ATLS, BLS. Does this locally?
Better than nothing. Better than nothing. If you can do from their hospital, it's good. But if you can do workshop like this, which is internationally recognized, that will be preferable.
Like American Heart Association offer this.
Exactly. You made it simple for me. Thank you, Taha.
Okay, sir. Any more questions? Sir,
We have still got 14 minutes, I think. Yeah.
Sir, yes. You carry. Sorry. Next question is how to get visa. Like, is it easy to get visa in Australia? Like for AMC
Look,
part.
until now, I have not heard about the visa issues for the doctors applying for the jobs in Australia. Obviously, when you will come for the clinical observership or for the AMC clinical exam, you will have to apply for the tourist visa. And when you will tell the reason that you have paid the fee for the AMC clinical exam, they will obviously give you the visa, but you should not be having any problem in your legal record. If you have some criminal offense against you in Pakistan, in India, Sri Lanka, Bangladesh, or in any other country, you are in big trouble and nobody can help you after that. But if you don't have any criminal record, if you don't have any criminal offense, you guys can easily apply, get the visa. Hopefully, it should not be a problem, but it all depends on the geopolitical situations which are very randomly changing at the moment. Like I recently heard that there was visa ban for the Pakistanis in America, but they were still not refusing the visas of J1 and H1 for the doctors going for the residency and the fellowship to United States.
Sir, there
And
is a
there is still a severe shortage of doctors in America as well. Keep that in mind.
sir, there is a real based question like as you mentioned in the lecture. There are doctors coming from Australia, sorry, UK or Ireland. Like there, someone
Mhm.
is asking if someone has done AMC Part One, now he is applying for a job, and same wise like a doctor from Australia, sorry, UK or Ireland is applying. How can we differentiate? Like what are the things we can done to so that they prefer us our graduate from UK or Ireland?
Okay, look, Taha, I will actually say that rather than asking this to yourself, how will you compete with those doctors? It's very, very, very difficult. You need to be too good to compete with them because why? Look, they are not trying to hire the doctor just based on a very superior experience from Pakistan or India. They are actually going to hire you based on the safety needed in the hospital. So if they are having the application from Ireland and UK, it's actually very difficult to compete with them. I've already given you the trick. I've already given you guys the trick in the lecture. Apply for the jobs in the regional and the rural areas so that you have less competitions from such doctors coming from Ireland and UK. It will be hard to compete with them. Just imagine, Taha, you are the director of the hospital and you are running a big hospital set up in Australia in Perth, and you get the application for job from UK and from Pakistan. Obviously you will prefer the doctor who is coming from UK because you know that this doctor coming from UK, he knows the system of working in the Western health system, rather than a doctor coming from even superior experience coming from Pakistan who does not know how to handle what is the pathway of handling the emergency, what is the pathway, what are the responsibilities of the nursing and the doctors, what are how to involve the allied health specialists, what is the culture, work culture in Australia. Obviously that is difficult. Obviously they will prefer you only if they have very severe shortage of doctors. And look, when we got the jobs in Australia, we were not like something of superior experience. I was a junior doctor in Pakistan. I was working as a medical officer for 3 years in medical intensive care unit. But I got the job because there was severe shortage. But obviously, I was able to present myself through my CV, through my cover letter. But at that time, there was not much competition coming from UK and Ireland. Probably if I had been applying for the jobs like in these times, I would have been getting the same competition. At that time, we doctors from South Asia used to get the jobs even in metropolitan areas like Perth, Sydney, and Brisbane as well. But now it's almost impossible. So the competition has increased, and I've already given you guys the trick. Apply in the regional and rural area, but also at the same time understand the regional areas and rural areas of Australia are really beautiful places. And you can even get the job in some of the rural and regional areas where there are mosques available, where there is a temple available for the Sikhs and for the Hindus, and the mosques available for the Muslims, or the churches available for the Christians. So you can still enjoy your lifestyle. Obviously not as good as like in Sydney, but at the end of the day, that's not going to be the place where you will be living forever.
Sir, the
Next question.
next question is related to AMC Part One. How to get the most out of John Mutag and Australian guidelines? Since John Mutag, it is a very hefty book, and what is the most efficient way of reading it out along with the Q banks, question banks?
Okay, it's a good question actually, though we don't have the time to answer this question. It's not a simple answer. Look, when you will start preparing for the AMC MCQ exam, you actually need to use this John Murtagh as a reference. For example, the medical students who are present in this gathering, if they are actually doing their final year, start using John Murtagh as well to understand a little difference present in Australian health system. But when you are preparing for the exam, look, when I prepare for the exam, I used Kaplan's series as my main books to prepare for the theory. And then I was doing the practice of the questions through those and Q banks available. So you have to do the theory, you have to practice through the MCQ banks available. If you are not confident, you can use some of the academies, but there are lots of videos available from Emergency Focus by Dr. Rizwan, from AMC Clinical by Dr. Patak, and then from Dr. Reed. And there are some other resources. There are a lot of YouTube videos available. So many doctors have shared their experience, and I had done my exam in 2010, but I know still now some of the doctors are preparing for the AMC MCQ exam from the PLAB, from the Oxford Handbook of Clinical Medicine, Oxford Handbook of Surgical Medicine, Oxford Handbook of Psychiatry, and along with that, there are some doctors who are doing from Kaplan series. I know some of the doctors who actually prefer from the John Murtagh, because when you start reading and doing the practice of the MCQs, you will actually learn how to prepare from John Murtagh. Like, I can't tell you on this video how to learn the swimming. You need to learn it. You need to jump into the swimming pool. So same wise, you need to learn. You need to jump into the pool of the preparation, and you need to go into that environment to start preparing for the exam, and then you will understand slowly and gradually. But there are a lot of helpful videos available on the YouTube.
Sir, there is a next question, and I think it should be the last question. There is a graduate of 2024.
And stop taking the questions after that. Yes, repeat the question now. Yes.
Sir, there is a question from someone who is a graduate of 2024. He has done his FCPS Part 1 in surgery and currently working as demonstrator at a medical college. Which pathway should he is ideally taking? AMC pathway or MLE? Currently studying for step 1, but the fears of not actually getting here at an early stage, as there are provided that financial restraints are there, and one has to make it on his own at this point.
Okay, look, that's a very complex question. I can't be the best judge to answer this question. You are the best judge for yourself to understand your consequences. I can't give the answer because, look, there is no certainty. There is no 100% answer that you will get the job or you will not get the job. You have to try your luck, but be prepared. You should always have plan B in your plan, that if you failed, then what? For example, take my example. I gave USMLE exam, and at that time I failed. There was a lot of financial pressure. I initially felt all of the money of my father is wasted, but then life has to go on. I came back to Pakistan. I started working as a medical officer. Initially, I was working in the private hospital setup, and then I was working as a medical officer in medical intensive care unit of Services Hospital, and I was enjoying that. I was very happy. And at that time, because I'm a positive person, I thought it's a blessing in disguise. Maybe I'm made for Pakistan. And keep in mind, if you fail, look, at the end of the day, your purpose should not be like, that was the last endpoint where I wanted to work in America and Australia. You should always have a plan B. I think if you got, if this doctor has done FCPS Part 1, I think he's in a very good position. If he could not succeed in going to the overseas, he can still complete his FCPS training and work as a consultant in Pakistan. All of my class fellows, Taha, you guys are aware, Dr. Maham, Dr. Tahir, Dr. Ghulam Murtaza, Dr. Arif, they are my class fellows. Dr. Imran from Physiology Department, they are my class fellows, and these doctors are doing extremely well in Pakistan. So staying in Pakistan, India, or in your own country doesn't mean that the life is finished. I want you guys to stay positive. Attempt for something. If you can come to the Western country, well and good. But if you cannot, there is no 100% answer what will happen. If you are preparing for a USMLE exam, if you have the budget, go for that. USMLE, I think it's a better pathway than Australia. More chances of getting the job. And along with that, I also want to answer that, look, if you have got a lot of affordability, and if you are a medical student, do your USMLE step 1 in final year. After graduation, start doing your house job and start preparing for USMLE Step 2 and start preparing for AMC MCQ exam. After that, go to America, give USMLE Step 3. Now you are eligible to apply for jobs both in America as well as in Australia. If you get the match in America, you don't need to look for Australia. However, if you are not successful in America, you can still apply for the job in Australia. However, unfortunately, some of the hospitals, some of the professionals, even in Australia, they are not aware for the competent authority pathway, experience in America, England, and Ireland is not a must. That is the reason I know one of the Dr. Rathore, I think is Anand Rathore, is stories available on YouTube. He has recently done both PLAB and AMC, but the depressing part is he has still not got the job.
Okay,
But
sir.
I've already told you the story of Dr. Pathak, who cleared AMC clinical after 7 years of AMC MCQ, and he has got the job and he had a big career gap as well. You have to try for the best and then leave the result to your luck.
Okay, sir. This was the best guideline from you. One last question, if you want to answer this, but it is like not related to AMC. How does it feel like to be in Australia considering the weather differences?
Australia is the best country to live from that point of view. As I've already told you, Australia is the best country from that perspective, from the perspective of the weather, from the perspective of the lifestyle. Why? In Canada, you have to clear the snow. In America, it's a very big country. The lifestyle is very stressful. In England, there are no jobs available at the moment. And lastly, Australia is the best place. But look, don't waste your life for Australia. If you can try for this country, if you can afford, try your luck. America is still better in terms of opportunities, in terms of the academic progress, better than Australia. But in terms of lifestyle, Australia is better than America. But at the end of the day, wherever you get settled, whether in Pakistan, India, America, Saudi Arabia, in Arab countries, or in England, that should be the best place for you. Don't depress yourself. Be positive, please.
Okay, sir. Thank you so much. We are really grateful to have you here. Now we are going to close
Humbled,
this session.
and I'm very humbled to get this opportunity to talk to you young doctors and medical students. I wish you all the best. My prayers and best wishes for all the doctors, and let me know once you place this on the YouTube so that we can share this to the people, and so that I don't have to do this lecture again and again. But however, for any help, you all the doctors can get through Taha, get in touch with me, and we can organize some more session if needed. But there are all of the videos available. We should not be running in the circle, repeating the things again and again. All the help and all the information is available on YouTube. I've tried to collect all that at one channel.
Okay, sir. Thank you so much.
And this video will be, Taha, can you tell the doctors where this video will be coming?
Sir, we will upload this on AUT lectures soon, inshallah.
Okay, that's the channel on the YouTube. Please watch for this video, and you can share this video later on with your other colleague and medical students. And again, my advice is look for the excellence, and the success will automatically come into your pathway. And enjoy your preparation when you're preparing for FCPS Part 1, or whether you're preparing for USMLE exams or Australian Medical Council exam. Enjoy that time period, because you are getting a progress, you are learning new things, and you are getting better and better day by day with that. And be honest, be truthful, and be the doctor with the good manners. Ethical values should be the high priority, and you can still stick with your culture, with your religion, and you can enjoy working in Australia.
Okay, sir. Thank you so much. It was great meeting with you. And
thank you so much to all of you as well to be the part of this lecture. And I wish you all the best. And I wish that you all medical students and the doctors become successful in future in every part of life. Take care, everybody. Goodbye.
Thank you so much, sir. Allah Hafiz.
Allah Hafiz.